Welcome to JoyMed Podcast, brought to you by SafeHaven, a program of the Medical Society of Virginia. I'm Melina Davis, your host. I'm the CEO and EVP of the Medical Society of Virginia. We're thrilled to announce the launch of this new podcast series, where we'll delve deeper into the challenges faced by healthcare professionals, explore strategies for resilience, and highlight the support systems available to them. Each episode will feature expert insights, personal narratives, and practical tools to help foster a healthier, more supportive environment for our healthcare heroes. Make sure to subscribe to our podcast so you don't miss this important series, and share it with your friends and colleagues. Together, we can create a culture of care and support, ensuring that those who care for us are cared for as well. Thank you for listening, and we look forward to continuing this journey with you. Welcome to the kickoff episode of the JoyMed Podcast, brought to you by SafeHaven, a program of the Medical Society of Virginia. I'm Melina Davis. I'm your host, and I'm so happy that today to welcome two guests, Dr. Varun Choudhary, who's the Chief Medical Advisor for SafeHaven, and Dr. Cynthia Romero, who's Director of the M. Foscue Brock Institute for Community and Global Health of the Macon and Joan Brock, Virginia Health Sciences at Old Dominion University. Welcome, both of you. Thank you for being here with us.
Thank you for having us.
Yes, happy to be here, Melina. Thank you.
Oh, I know you both so well, and I feel so grateful to have learned so much about you over the time. But let's start by helping our listeners learn a little bit about you. You're both leaders at MSV and have been for a while. What brought you to MSV and organized medicine? Varun, why don't you go first?
Certainly. Part of the reason I wanted to get really involved with MSV is because I found that as I was working in the Virginia system, there really needed to be representation for mental health. At MSV, I found that I was one of maybe two psychiatrists at most, and that the psychiatric establishment really wasn't connecting with the medical establishment. And this has been an ongoing thing in this country forever. It's like the carve out of psychiatry and mental health away from medicine. So my personal goal was, let's combine the worlds. Let's make sure that we've got mental health and behavioral health represented at the medical establishment and then at the legislative establishment, because of course, a lot of our physician legislators got their start from MSV. And so I noticed that and thought, okay, maybe I can represent.
Well, goodness, you've certainly had an impact since you joined. Sid, what about you?
Great.
What brought you?
Yeah, so my story is definitely a personal story because about 35 years ago, when I was a first-year medical student at Eastern Virginia Medical School, then before where we are now, my mom, the late Dr. Romero, was in private practice in family medicine with my dad as our office administrator. And as soon as I entered medical school, my mom said, Sin, there are so many regulations now that are impacting especially primary care, and it is really creating more of a distance between physicians and their patients, and it's making it harder and harder for physicians to enjoy the practice of medicine. But the people I'm going to introduce you to are going to be individuals that know how to not only, rebut and, criticize some of these new policies, but they'll be able to help you learn how to be part of creating and making better health policy, since I don't know how to do that. So my mom introduced me to the Norfolk Academy of Medicine, which is then was the local component society of the Medical Society, and two former presidents, not only of the Virginia Beach Medical Society and the Norfolk Academy, but also former presidents of the MSV, Dr. Randy Gould and Dr. Mitch Miller, took me under their wing and helped me better understand the policymaking process. And, history has been made until, I became the president of the MSV in 2010, 2011. And so I've been involved with MSV now for a very long time, and to recognize that mental health is a significant part of the training that is not incorporated as much into, what does it take to become a high quality physician and to take care of patients in the community. So SafeHaven has allowed me to bring all my worlds together and to be able to recognize that health disparities that are really plaguing patients across the country and certainly in Virginia can only be addressed if the health workforce is in their sweet spot and finding joy in what they do every day.
Yeah, I love that. Sweet spot and joy all in the same sentence. I love that. Well, it's a gift for me and for our entire staff team to work with you both. But I brag about our physician leaders across the country as I speak, that we are so lucky to have the wisdom and insight and camaraderie that you all share to just have as a resource around us, but also for that leadership. And I want to take you back a little bit pre-COVID, pre-development of SafeHaven, around 2017, 2018, and just have you reflect for a minute on what you saw happening with your peers and what started to lead us to going through the discovery process that led to SafeHaven. What did you see then that people need to hear, and tell that story?
Reflecting back on that time, it seemed to be the practice of medicine was really taking the front seat. And with physicians, the struggle was you had systems and you had policies in place that sometimes conflicted with the ability to give the highest quality care to your patient. And it was that, I think that battle, if you will, between profit making and patient care that really started to wear down on physicians. And the pandemic amplified all of those problems that were bubbling at that time. At least that's how I see it.
And we were hearing then that people were burning out. Like, that was a regular and normal part of conversation then.
Yes. I remember the program we did before SafeHaven, and we were really
Infuse.
Infuse. And we were really looking at how can we as the medical society help our colleagues, help our peers, because we saw their struggles.
Mm-hmm. Yeah. So what do you remember about that time?
Yeah, so before COVID, the healthcare delivery system was already strained with an overworked workforce, high demand for healthcare, and limited access. I think reflecting back now, what the pandemic did was it infused another sense of complexity into patient care, in that there was also fear and uncertainty and lack of understanding of what was really happening in the world, and for physicians and all clinicians to be in a situation where they weren't clear of what the guidance was going to be clinically, how to handle this. But I would also say, as the pandemic was unfolding, not only was there even more increased volume in the emergency departments and in the physicians' offices, there was really a sense that patients were starting to feel even more anxiety and stress about what's happening, and to ask the physicians questions, and the physicians to not have the answers consistently. Yet again, for physicians who are trained in evidence-based medicine and knowledge and information, to be in a position not to have consistent information to relay and calm their patients down, especially in the outpatient arena and certainly in the inpatient where they're the sickest, and then their family members. Again, it just created this higher sense of chaos. And I would say the other pieces, as the pandemic continued to unfold and that, stay-at-home sense of order came in, I think what was challenging for the healthcare system, but particularly for physicians, was when patients and everyone, including physicians, were told to stay home. For physicians in particular, those who are in the office or in the hospitals, to be told that they couldn't take care of patients one-on-one, elbow to elbow, eyeball to eyeball, that's like taking away one of their feet or one of their hands. Yeah. So I think that sense of, I can't do what I was trained to do, I can't do what I love, again, was layering into the frustration, the fear, in addition to the burnout.
Yeah. And this call that is so real that I see from medical students, PA students, all the way to practice is this idea of service, right? That I'm called to serve, right? And that was getting harder. And then COVID and certainly was blocked. I mean, I know some people just couldn't serve. It was a very difficult moment. One of the things we started in 2017, 2018, when we started to pull together and fuse with many of our component medical societies, the Richmond Academy of Medicine, the Norfolk Academy, the Arlington or the Virginia Lynchburg Academy of Medicine, all came together because we were all trying to figure out in Virginia how we could help, because we could feel it too, and we didn't know as professionals how to help. But what we were just trying to see what would work. But it made us realize that there was no one thing that was going to fix it, but that what we noticed is that at Infuse, they would talk to us, right? And at any MSV event, they would tell their story, share their story, and whether in group or in person. We had Lynn Hughes. Do you remember Lynn, who worked for the Medical Society? And Lynn was a national expert on grief before she even came to MSV, and she started to notice a trend that people would share their moments of burnout. And she said, I see signs of grief here. Did you all see that at the time and hear that?
Absolutely. I'll jump in. I think a lot of the issues also was that people never really asked the physicians.
Yeah.
They kind of assumed that physicians were always going to be okay. They always assumed that they, were trained to be able to handle this type of burden and this type of stress. But I think as we've seen, because the healthcare delivery system incentivizes seeing more patients to generate more revenue, to reduce the costs, et cetera. I mean, all these considerations, I think, for professionals who are in a business to care and to serve and to be almost distracted with all the other issues of how do we manage administrative things that weren't part of our medical training, in taking us and separating us from that patient relationship. I think it really was a sense of loss because they were being distracted by more administrative considerations and trying to problem solve related to workflow, as opposed to enjoying those critical moments of being so close in the relationship of the patient, understanding and learning about what they were suffering from, and then gathering from our knowledge, expertise, our resources, and our colleagues to know how to help the patients feel better and get better. That sense of loss of being able to do that, I think, is hard for physicians.
I completely agree with that perspective. And it's almost as if you had physicians having an existential crisis of, I got into medicine to help people, and now it's become just this a big business, and I'm a cog in the wheel. How did I get here? And I had so many colleagues who were going through that same kind of thought process, regardless of whether they were working at a hospital or an outpatient clinic or a state facility. So there was a certain universality of that kind of angst that was going on in the community.
One of the things that, our staff team was always wowed by is that there was so much trust inside of the medical society with our leaders and our members that very personal stories would be shared. But we couldn't understand at the time why physicians weren't speaking to their colleagues or weren't getting counseling to help them with what was clearly they were identifying as burnout symptoms. So we started going across the Commonwealth and listening. And it wasn't just staff. We had members, like you said, that I know were out there, and Varun, talking to people, listening. You actually participated in some of these group interactions with people, listening to their stories, but really asking the question, why aren't you talking to professionals to get help? What do you think? I know you guys know some of these answers. What were they afraid of?
Physicians are trained to compartmentalize, and it's almost a necessary part of the job. So when you're taking care of somebody and it's a life and death situation, you can't think about anything else that's going on, any other worries that you have, any other concerns. You've got to focus on that task at that moment. And this becomes an ingrained defense mechanism.
Mm-hmm.
And so when you start boxing everything up and there's a large amount of clutter and suddenly everything spills over, that's the point where you have physicians that are finally acknowledge that there's something wrong.
Mm-hmm.
But it takes that much time to build up and build up and build up until they can't compartmentalize anymore, and it just all spills out.
Right.
And it'll come out in different ways, whether it's being unable to really control your emotions, you start having problems at work or problems at home, sleep issues, all of those things. It starts to pile on. And physicians, unfortunately, are not trained to ask for help when they start feeling that way.
They give help.
Yeah. And so they don't know what to say and how to say it in order to get the help they need. And that's part of, I think, why SafeHaven has been such an invaluable organization, is that it helps physicians ask for help.
I will agree with my psychiatrist colleague who used the word compartmentalization, but I'll build upon that and say that physicians, the personalities of all physicians, regardless of specialties, really come in with that sense of, we can do this, right? We can do this. And the whole consideration that we can help others. We can help those in need. We know what to do to help those who are suffering. We oftentimes have a hard time acknowledging that it is us that are the individuals who are in need, and that we are the individuals who are suffering, right? And as human beings. And I think there's a mindset also that physicians are not just human beings, but we're human beings that have a strong sense of purpose and a strong sense of capacity and ability, right? And we're the captain of the ship, the problem solver. We are the ones who can understand, the whole spectrum of the physiologic, biologic, emotional things of the patients. Yet when it allows us, to actually stop and realize that we are the human beings that have some needs as well. Again, we're so others focused and service focused that I think that's one of the challenges for the physicians of our generation. But fortunately now, post-pandemic and where we are with our healthcare system across the country and certainly across the Commonwealth, is that we're recognizing through SafeHaven that we need to help provide all the support for the practicing clinicians and physicians of all specialties and certainly all healthcare professionals, but also to start teaching the capacity to the next generation of healthcare professionals, the medical students, the residents, to let them find that sense of you've got to take care of yourself so that you can continue to take care of others. And that is part of what your training is all about. And it is not a weakness. Okay, and again, I think that's another sense that
it's just part of the stigma idea, right?
Definitely stigma. If we ask for help, if we don't really know what's going on within ourselves, that may be perceived as a weakness.
Yeah.
So
the stigma in medicine, Varun, that you can't be weak because people might need you.
Right.
That you've got to compartmentalize that, right? I think when we hear stigma, trying to understand what that means in the profession is super important to breaking it down. Sorry for
no. I was actually going to agree with that point and essentially say that it's more of a strength, because if you think about one of the first caveats, A, do no harm, B, physician, know thyself. Those two principles are embedded in when a physician knows himself or herself well enough to ask for that help. It's a strength. The challenge that we've had in the established medical field is what Cyn said. It's gotten to the point where it's about reimbursement rates and the number of patients that you're seeing and your RVUs and this and that. And so people get so caught up in the business of medicine that we're starting to lose the essence of medicine.
Yeah, super important. As the staff team too went around and really listened and had conversations like these. I mean, it really did take us a year to actively listen and try to understand what people were hearing. We heard that there was also fear beyond stigma of what does it mean to my peer network and my referral network if I show weakness? Mm-hmm. And what will my employer think? Will my employer bench me? Will they not think I'm trustworthy? And then I think there was this big cloud around, if I have to self-report, where's the line where I have to self-report whether my capacity is reduced or I'm, impaired in any way? And what if, does the peer I talk to have to report? These are some of the things we were hearing. Did you guys hear similar things?
So absolutely. And I can tell you that there are still state licensure bodies where they ask those questions when you're filling out the legal forms to renew a license or to get a license. So you've got this established built-in administrative stigma there.
Yeah.
And it's propagated that way. And so part of it is asking for help is not a weakness that we should have to report on a legal document when we're getting a license.
Yeah. And I would say part of this, as Varun refers to the established medical practice or medical environment, I think we have to appreciate the administrative side where a lot of these policies and a lot of these procedures were put in place with the overall goal of assuring that the system is as safe as possible.
Safe for patients.
Safe for patients, safe for the
Yes.
community, and certainly safe
Yes.
for the physicians,
Right.
right? And to identify that. But you're right. I think the whole process has created this stigmaed landscape where, again, the physicians have been feeling like they have to be at their best to be able to perform their best and for patients and everyone to trust them.
Yeah.
So I agree that
You're
that
either
whole
weak
concern-
or not weak.
That's
Right?
right.
Weak
Right.
or not weak. And
That's right.
And we know humans, we're not
Right.
that extreme, right?
Exactly.
We actually have a continuum that we
That's right.
operate well in. I'm talking to a psychiatrist here as though I'm explaining psychiatrist to him. But one of the things I think we're still battling is this notion, right, that you can ask for help. You can be getting help and still be healthy. You can still be competent. You can still be practicing well. And SafeHaven, I think, was the first effort, and it started in Virginia, where we actually went to seek protections so that people could safely talk to a counselor or coach, and they wouldn't be fired. They wouldn't be reportable to the board, and that they would have a very high level of confidence that there would be privacy with regard to their medical records, which they didn't know before because of the licensure reporting issues, right? So what's interesting is Virginia was the first one to do that, and that we submitted that as an emergency resolution in, January of 2020. Who knew what was coming? And signed into law March 8th of 2020. And we thought we'd have the year to figure out what services to provide to go with the protections to encourage people to start talking. But why is it important to get people to start talking and get the conversation started versus hold it all in and pretend that you're, perfect?
I think we've touched upon a lot of those points. Is if physicians are waiting until it builds up so much it spills over,
Right.
by that time, there are already different levels of impairment. It might not be functional impairment at work because you're still compartmentalizing, but then when you come home, you're falling apart. Your family life is suffering. Your professional life starts to suffer because you can't contain that anymore. And it is much more difficult to get the help at that point than sooner. And
Right.
the reason I say that is because things start to build up and and spill over to your whole life.
Mm-hmm.
And at that point, it's really looking at the fact that you've experienced this trauma. Now you're trying to contain the damage.
Yeah. It's almost the plaque buildup, right? Yes. One of the things that we know is behavioral health works, right? Why does it work? Why does it help to talk?
If you think about the connection between mind and body, Descartes was wrong. There's no separation of mind and body. It's one and the same. So when there's something going on inside of your head that is triggering, you're going to have a cascading effect on your body. We as physicians know about cortisol and how the adrenaline system can run that ragged, and that actually it can impair your immune system and make you more susceptible to getting sick. So there's such a strong connection there, and it's an inseparable connection. We've got to start looking at the person as a whole. And you can't separate what's going on in their physical health from their mental health.
Right. And we have to make it okay for the profession, right? And make it safe to encourage that.
Absolutely.
One of the key ways that we sort of addressed this was we had to define what was reportable. To Sen's point about patient safety is paramount. We have to know when somebody's impaired or about to be impaired, about to do harm to themselves or others, started to be the line that professionals could start to diagnose, and we could clarify. Before this law, before the SafeHaven law, there wasn't clarity on that. There was a lot of opaqueness, and that, I think, contributed, right, to people not talking.
I was just going to add that one of the things that we were not trained to do in medical school and residency was to keep ourselves healthy and well. And when we did not get a chance to check a box to say that we've exercised, we've ate well, slept well, drank enough water, had good relationships, social support, etc., that wasn't part of our training. But I think as far as what are the protections that the legal system was trying to regulate, I think what SafeHaven has been able to identify is that if physicians are able to not only talk about what is going on in their mind about stressors and potential burnout, but to actually acknowledge that that's what they're facing,
right?
That I think the regulations should really be helping to identify those who are impaired enough that they cannot have clinical, appropriate, safe care for their patients. But to recognize that there's an on-ramp of the burnout phase that clearly, if it is addressed early and strategies and tools are utilized, that physicians can acknowledge what is putting pressure on their soul, but certainly on their mind and their body, and how they could actually be well enough to reach into their joy and their ability to pull in their positive mechanisms, right? So to recognize that, again, just because a physician or clinician admits that they're being stressed, they acknowledge that they've experienced trauma and they're feeling burnout, that's not necessarily saying that they are experiencing a mental, a serious mental illness that should compromise them and require medications and, carving them out of the system. There is really a spectrum, and if there are better ways for the system to identify those symptoms early and then implement the tools like SafeHaven has done, that way the regulations of identifying those who are truly at risk for causing harm to themselves or to their patients really can be protected away from the system.
Yeah, so important. So important. So with SafeHaven, we have the protections to encourage people to get the help. We have the clarity around impairment and where that line is. And then we added all the services, which is 24/7 access for people who work very odd hours and very long hours, so that they can get help when they need it in the moment. They don't have to wait until they're at 9 in the morning and on shift, right? But coaching and counseling for master's level and certified coaches, but master's level therapists, and ongoing education. So we know that this is important. We know we're going to have to keep adding these kinds of partnerships and services as we learn more. But having professionals that people can reach to and deal with their thing, we know it's going to make a difference, right? And we already we're seeing a 14% increase in wellness from people who have subscribed and taken advantage of it already, which is incredible. Incredible. Why do you think that our board leadership continues to be so passionate about not just having this in Virginia, but spreading it across the country?
Because they know it's the right thing to do.
Right.
meeting professionals and meeting clinicians where they are is going to be extremely important for the success of the program. As you said, physicians are so reluctant to get help that when they do get to that point, really having the different levels of need met is going to be very important. Mm-hmm. And having those resources and knowing that the treatment and the help that they're getting is protected. Mm-hmm. And they're doing it for the right reasons. And SafeHaven is doing it for the right reasons. That's going to be the most important component.
And I will simply add that, again, MSV staff have been listening again, yes. and just setting the programs and the services up based on the feedback that they have gotten from the physicians is huge. Prioritizing what we've asked for just makes it that much more effective. Mm-hmm. And the fact that many of our colleagues, especially those who have subscribed to SafeHaven, are definitely seeing the benefit. It's like, and the one thing I will say about the physician community is that when we find something good, we share it, right? When we share it, and so this is like one of those opportunities where it's like it really is a gift, for not only the SafeHaven program, but for the services and support to allow us to unwrap some of the challenges that are facing all of us, and to find these tools that are allowing us to recapture the joy and to recapture the joy in the collegiality that we are fostering. So I think one thing that I will say is, the strength of the medical society is that it really is a partnership between the members and the staff, and the fact that it really is a family. And for those of us who are engaged in all aspects of the MSV family, we do it because it really is addicting, and in the good because way. in the most positive way, because it is again tapping into our sense of we're being given knowledge and information that helps us to in turn not only be better for ourselves, but more importantly, to be better for our colleagues, our physician colleagues, and then certainly our patients ultimately. Mm-hmm. And I think patients are starting to see that difference, that when physicians are acknowledging that there's human beings that need help support in fostering resiliency, that the patients know, you're going to take better care of me when you are feeling your best.
Yes. So. And we see that this doctor-patient relationship is so vital to better outcomes for patients, right?
Absolutely.
In 2020, when we originally passed this legislation, we passed it to protect physicians and PAs. We didn't, at the time, presume that we understood what nurses were going through, or pharmacists, or dentists, or even medical students at the time. We didn't understand. Every year since, we've included more and more people in this protection legislation and provided them services. But first we went to their professional associations to make sure we were listening to them. And I think it's really important that our physician leaders and leaders of MSV said, do they need the same things? What do they need? Let's not presume it's the same. But if so, let's see what we can add, and let's see how we can help. And I think people find that very surprising, that not only is SafeHaven now spreading across the country, it spread to other professions. And now I think the Department of Health Professions in Virginia has asked us to have it apply to all licensees, which we're going to work on in 2025. It's incredible what you all have done. I mean, it's just incredible. How do you feel about it applying to the whole team and even beyond your sort of daily team?
It's a wonderful acknowledgement of the success of the program. And regardless of the background of the clinician, they're working in the same kind of system. And it's the same systems issues that everyone is experiencing. And so being able to provide this service for whomever in the clinical world needs it is just a gift. It really is.
Agree. And, when we're considering that this is really seeing where the puck is going, where, especially with the health workforce shortages, right? We need to promote and enhance and strengthen the teamwork and the team as much as possible. So it certainly makes sense that everyone who's involved in that clinical team in particular really should be getting the supports to help them acknowledge any trauma they're experiencing, but also the tools to stay as well and healthy as possible. And ultimately, if we were to dream big about SafeHaven, not only helping cover the clinicians and the licensees that are covered by the Board of Health Professions, I would love to see this type of concept be across, all aspects of the healthcare delivery system, which includes some of the administrative individuals, because by nature of how healthcare has evolved into a business that is, representing in many cases up to 20% of our gross domestic product, right? When we see that it really is impacting not just the clinical workers, but also administrative and support, everyone involved in the healthcare system.
Yes.
Everyone's experiencing trauma, right? It's just a matter to what degree and to what degree they have the supports to help them. So I would say let's start with the professions and the professionals that we know are in that hot seat and really involved in the direct patient care. But ultimately, we have to acknowledge that post-COVID, everyone is suffering from some type of mental stressors. How can we help support and advocate for safe haven type of tools and models so that everyone in our country has the opportunity to be as healthy and well as possible.
Yes, and be encouraged. And we are hearing that from some of the hospital systems and practices that we visit, that can this apply? Can anybody that we employ or work with be part of this? And the answer is yes. I mean, there's no holds bar. I mean, our staff has said to us, can we do it too? Because what we're seeing is more people wanting help, not fewer people wanting help, right? The trick for us has just been trying, how do we get it as fast as we can into people's hands and make it affordable, right? It's interesting that it's actually less to have a subscription for you and your whole family than a cup of coffee a day from one of our favorite, drive-through providers. But it's interesting when an employer tries to afford a year's worth of coffee from that place for everybody, it can be onerous for them to decide. But the costs are so much greater if we don't really do this. And one counseling session could be more than that year cost, interestingly. It's odd how we don't understand that the cost of being healthy versus the cost of being unhealthy, right? We don't think of them in the same terms.
Exactly.
That's a weird thing.
Exactly. And even if we just look at where our dollars are going to support health and health care, right? Right now, our system is incentivized to pay for and react to disease.
Yes.
Right? And it is just now over the past few years that the investments in promoting wellness and resiliency is starting to take hold. But that needs to be a little more balanced, or even more so, we need to be following what's happening in other countries and having our U.S. healthcare system invest in and really support health, wellness, and resiliency.
I think the whole movement away from fee-for-service going towards value-based care is one small part of this whole. I would love to see a measure as far as value-based care goes that reflects the health of the provider, of the physician, of the clinician. Incorporate that into measurement-based care and reward physicians for taking care of themselves as well as their patients.
We've had some folks suggest that sometimes the system might need to think about how do you give people time to be well, right? And have a moment or time to take away from their work and somebody else step in without the guilt of that process. That is also an expensive proposition, but again, can we afford not to have people have time out?
And I think the whole conversation about normalizing wellness, right, without compromising productivity, right, and recognizing that productivity has to be part of the equation right? It's not just everyone's going to be taking a vacation and considering, mental wellness as their main job now. I think we have to really complement the system by saying it's been skewed towards, burnout and, over-focused on just the productivity. But I think we'll actually see that there are measures that indicate increased productivity, increased, culture of, wellness within the workplace if health and wellness is focused on in the beginning.
Yeah, that makes sense. So 2 questions for you. One is, what's your favorite story that you've heard so far about how SafeHaven or people getting help, what difference it's made?
So thanks for asking about that, Melina. I would say one of the recent stories I've heard is when a medical student shared with me that, again, they're about to graduate from medical school. So they were a first-year student during all of the COVID-19 chaos, and how they didn't even get to know their fellow medical students until they were out in the field with me, after being trained to administer COVID-19 vaccinations. And we were out there in the community administering COVID-19 vaccinations to the most at-risk and in-need communities. Mm-hmm. And for them to say that if it wasn't for that experience, they probably would not have had the joy that they have now graduating. But the fear of the future and not knowing, where they're going to be going, and just before the match, when they had gone through the investment of traveling, and even having interviews, etc., that fear and anxiety was really overwhelming to them. Mm-hmm. And they were so grateful that they had the opportunity to realize at the moment that one of their other medical student colleagues reminded them about their access to SafeHaven. And
nice.
At, in the middle of the night, they were able to connect with a peer who was able to help them with some tools and strategies that made them realize that they were in the right spot. They've done everything they needed to. And then lo and behold, a couple of weeks later, match happened, and they actually matched at their first choice. So that was very much a success story.
Yeah,
and
no
again,
kidding.
Very recently and
very real and very normal to their experience, mm-hmm, right? Mm-hmm. So many of these stories, one I heard was, it seems so light and so silly, but we actually also have a concierge service as part of SafeHaven, because people who help other people don't always have time to help themselves. But I think it was a resident getting ready to go to shift, and a bird flew in her house right as she was leaving, and she had no chance, but she had to just leave, and she didn't know who to call, so she called the concierge service, and they literally sent somebody to get a bird out of her house. And 12 hours later, she showed up, and it was taken care of, right? But it can be small things about asking for help right where you need it, right? Exactly. Or it can be matching, which, life-changing moment. That's funny. If you had to have a vision for where you think SafeHaven can go next, or what could SafeHaven be in the world, and think big, national level, what would you hope as an MS leader, as a leader in medicine, what you would hope would be next?
I would love for it to become federal policy, whether it's the Department of Health, CMS, whomever at a national level recognizes how, and I don't use this word lightly, but how revolutionary this has been for the physician community, for clinicians, for healthcare professionals. So it would be wonderful if these protections were put into place on a national level, and anyone in any state can get the help they need.
Huge, wouldn't it? It would.
Yes.
I also would agree to have it at the federal level. Yet I would also say that revolutionary is a key word, but I'd also say transformative. Mm-hmm. And, what comes to my mind is to have it be a multi-agency policy. So it crosses over not just all health professionals, but as I was referencing earlier, to actually cover the general public and public health as well. Because what we recognize, even though there are particular protections that are very helpful for the healthcare professionals, I think the workforce protections that employees and leaders need are probably inhibiting some from even asking for help in other corporations that are healthcare serving. But I would say if the consideration that the CDC working with the AMA and the American Heart Association or the American Hospital Association, and other agencies were to focus on grace within the system, recognizing that most of the systems have infrastructure that are human beings that could appreciate the grace, and really that everyone has the good intentions to help things get better and not have this animosity and divisiveness and us against them, but rather have that true national interagency collaboration to say we are all focused on the mental health and wellness of our entire workforce and our community. So those who are delivering healthcare and certainly those who are trying to receive it, so that there really is this true benevolent, overarching sense of we're all trying to do the right thing. Let's just get to what's causing the problems and figure out the best way to help make everyone as healthy and well as possible.
Yeah, I think that's so empowering and so positive. I've visited recently with a conference of people in EMS and firefighters, and been hearing from teachers that there are all of these professions that are really struggling in crisis, and that this is something that our whole country needs, and it needs to be normal. And I love lifting our eyes to this idea. I love the word grace. I love the word joy. I'm so glad that we have the opportunity through JoyMed and this podcast series to talk about things that are this significant. And I just want to say your leadership, the leadership of Virginia's medical community, is so inspiring to me personally, and I think already making such an impact across the country. So I know you two have been vital to this conversation and center to setting the tone, and inviting others to participate. Thank you for being here and sharing your stories and your insights. Grateful.
Thank you so much for having us. This is an important part of really getting the ideas and concepts of SafeHaven out there. And I'm hoping that in my lifetime, both Cyn and my visions for SafeHaven come true.
Me too.
Yes, and thank you for having me, Melina. This has been really a joy for me, but also want to acknowledge and thank all the clinicians, especially the physicians out there, who are trying to do the best they can, and to let them know that there is help and that they can have true joy again in medicine like they've always wanted.
Yes, thank you. Thank you so much. Thank you for listening to JoyMed, a podcast series I think you'll find very interesting and compelling, all dedicated to making our healthcare workforce healthier. Come back and hear us soon.